Why does my periodontal disease keep on coming back? Why do I keep on getting pockets? Why is it still bleeding when the hygienist probes? This is a question the hygienists are asking. This is the question patients are asking. Everybody is doing their best to treat the periodontal disease. Now, often we blame it on the patient, don't we? Oh, do a little bit better here. Use the proxy brush there. Oh, I see a little bit of plaque here. Let's get that plaque out. And here's the real source of the problem. The real source of the problem is that the root surface has never gotten completely clean. The root surface has calculus on it. But we did scaling and root planing. We did all the things we were supposed to do. It's well established in the literature that hygienists can only get 4 millimeters below the gum line and clean that root surface predictably. And that was in an experiment that was done which allowed the hygienist all the time that she wanted to get onto the root surface. 4 millimeters, that's it. Hygienists, how many of you are treating 4 millimeter pockets? Patients, same thing. How many of you have 4 millimeter pockets? So it keeps on coming back. It keeps on coming back. Even with some of the most advanced therapies, it keeps on coming back. And the reason is very simple. The calculus was never completely removed. There's only one way that we can get that calculus completely out. And that is to see the calculus. Now, some would say maybe surgery allows us to see the calculus, and it may. But sometimes you can't get access to the calculus even with gum surgery. You can't see below the gum line that far. In addition, there are some areas of the mouth that are just inaccessible even after surgery. What's the answer? The answer is to put a camera down into the area below the gum line. Use a periodontal endoscope. Periodontal endoscope, a 1 millimeter lumen, 1 millimeter, about the shape and size of a periodontal probe. Put that below the gum line, and now you see in this patient, notice the depth of the pocket. Take a look at the x-ray. Look how completely clean that root surface looks on the x-ray. Now what happens when we place the scope down into this 7 or 8 millimeter pocket? See that? Yeah, that's calculus. So even though it looked great on the x-ray, when we put a scope down, we see, look at that point of calculus. That point of calculus is what's causing the pocket to remain. So now the hygienist visualizing the calculus with the endoscope now has the opportunity of cleaning that calculus out. And you'll see it step by step by step. And now finally the root surface is clean. When the root surface is clean, then the body will heal. And when the body heals, the pocket won't keep on coming back.